Hi, Ms. Johnson. How are you? My name is Crystal Brown, and I'll be your nurse for today. Can you just tell me your first and last name and date of birth? Thank you. Let me just look at your chart right quick and see what your provider ordered. Perfect. I noticed in your chart that you're not allergic to anything. Is that correct? Thank you. Mrs. Johnson, I need to place this nasogastric tube for decompression because of your small bowel obstruction. It's a flexible tube that passes through your nose to your stomach. Have you ever had this type of tube before? And do you have any goals? Do you have any questions at this time? Alright. As we do this, you may experience some gagging as we insert it, and as the tube is removed, I will be talking you through the procedure the whole time. If you need to communicate with me during the procedure, you can tap my hand or blink 3 times. Sounds good? Alright, well before we start, I will close the curtain for privacy, and I will put my clean supplies on a clean surface, and then I will perform hand hygiene. Alright. Performing hand hygiene. Alright. Are you ready? Perfect. Can you rate your pain for me on a scale of 0 to 10? Okay. Are you having any nausea feeling right now? What about vomiting? Have you vomited today? Okay, since you are experiencing some nauseating, the NG tube may help with it as well. Now, I'm going to look into your nasal passage with my pen light. Is that fine? Alright. Everything looks good. Patient is not experiencing obstruction, nasal polyps, irritation of mucosa, and septal effects. I'm going to press the right side of your nose. Can you breathe normal? Perfect. Now I'm going to go on your left side. The same thing. I'm going to press on it and just breathe normally. Perfect. Now I'm going to test your gag reflex with this tongue blade. It might be a little uncomfortable. Okay, everything looks good. I reviewed your chart, but just to verify, have you been experiencing any recent nosebleeds, nasal trauma, or nasal surgery? Perfect. Now we'll be going to listen to your lungs. So I will be moving your gown. Is that okay? Alright. Alright, everything sounds good. Now, I'll keep your gown up so I can inspect your abdomen. I will be listening to your bound sounds and then touch your abdomen lightly. Go listen to your bowel sounds. Alright. And now I will be pressing lightly on your abdomen. Please let me know if you're having any pain. You okay? Perfect. Now we'll be sitting you up high Fowler position and raise up the bed to my hip. I will be performing hand hygiene right now. Okay? Here is your Emerson basin. If you need it, it'll be right on your right side. And here is your tissue if you need it. Correction, I'm going to put it on your left side. It'll be more convenient. Next, I will be placing a towel. And I'll also be placing an oximeter. I will be measuring your oxygenation throughout the whole procedure. Now I will be preparing the tapes. And after I'm done preparing the tapes, I will write down the time and date of today. And the one that has the time and the date will be on the bridge of your nose. Okay, tape is on the side of the table. Now we'll be writing the date and the time. Alright. And now I will be donning clean gloves. Alright, now we'll be opening the package. And I will be putting some water-based lube on the package. And now we'll be doing some measurements with the tube. I will start from the chest to the ear, chest to ear, and then from ear to nose. From ear to nose. And then I will be adding 10 centimeters into it. I will mark it with a tape. marked with a tape. Okay. Now here is a cup of water. I'll tell you when to take a sip of water as the tube advances. This helps make it go down smoothly. Now I will be dipping the first 4 inches of the tube onto the lubricant. Okay. We are going to start. This may feel comfortable. Are you ready? Alright, here we go. How you're feeling? Well, you're doing great. Please touch your chin to your chest now and take sips of water. Are you okay? Keep sipping water. You're doing perfect. We're almost done. Alright, how you're feeling? You okay? Alright. We're done. Now I'm going to secure the tube to your nose with the tape that has the date and the time. How you're feeling? Still feeling good? Perfect. We're almost done. Just making sure the tube is secured in your nose. Okay, holding on to the tube while I'm putting the tape on there. You okay? Alright, how you feeling? Perfect. Let me just adjust this tape right quick to make sure it's actually secured. Alright, how you feel? Well, you did great. Now we'll be attaching a connector to the tube. I'm going to look at the back of your throat with the pen light. Alright, everything looks good. Now I will be listening to your lungs. Just going to put your towel down. Breathe in. Breathe out. Alright. Everything sounds great. Now I'm going to test the gastric contents with pH paper. Now I'm going to use the 60 ml syringe to remove gastric contents. How you feeling? Still doing good? Perfect. Make sure the tube is secured. Now I'm going to place it into the small cup. Alright. Now we'll be testing it out with the pH paper. Paper shows 4.5, which indicates that the tube is placed in safely. Now I remove the content from the cup. Insert it back in the tube. You okay so far? Perfect. Now I will be fastening the tube onto your gown. Okay. Tube is fastened onto the gown. So I received x-ray confirmation that your NG tube is in the right place. I'm going to hook it up into the suction now. Are you feeling okay still? Alright, perfect. I'm just going to keep your head elevated 30 degrees. And I will clean up everything. I'm going to remove your O2 oximeter. Your oxygen was perfect throughout the procedure. Now we'll be raising up your side rail and ensure the bed is at the lowest and locked. I will also remove my gloves now. And here's your call light if you need anything. Are you okay? Alright, perfect. So within 24 hours, I will be back to keep you posted. Now I will be performing my hand hygiene. Hi, Miss Johnson. How are you today? Alright, just going to perform my hand hygiene. Just for re-verification, can you tell me your first and last name and date of birth? Perfect. I'm just going to put on my gloves before we start anything. How's your day so far? Have you been feeling any discomfort or anything? No? Perfect. I love to hear that. Well, I know you're so excited to remove this. Alright. Your bowel sounds have been normal, and I received healthcare provider orders to remove your NG tube today. This will be much easier than insertion. Are you ready? Perfect. Now, I will be placing you in high fowler position and provide you some tissue. And also put a towel over your gown. Are you ready? All right. Now, I will be inserting 20 ml of air into your tube. Now I will be starting to remove the tape. Are you okay so far? Feeling any discomfort? No? Okay. Just making sure the tube is secured by holding it while I remove your tape. Okay. You're okay? Alright. We're going to detach it from your gown now. Alright. Detach from your gown. Alright. So while I do this, can you take a deep breath in and out and hold it while I remove the tube? Alright, here we go. You okay? Alright, just deep breaths in and out. How you're feeling? Yeah, all right. You okay? Tube is out and intact. Okay. Now I will be removing your towel. Remove the tissue. Do you need a tissue? No? All right, perfect. Just gonna remove my gloves. And I will be performing hand hygiene. How are you feeling right now? I know that was a true reliever for you. Well, perfect. Can you please let me know if you ever feel nauseated, feel pain or discomfort? All right, perfect. Are you feeling any pain? No? All right. Well, since you're feeling good, I will be raising the side rails and ensure bed is in the lowest position. And make sure the bed is locked. Here's the call light if you need anything, okay? All right. Is your pillow okay? Pillow's perfect. All right. Well, have a good one.